Myself, Mrs. Shubhangi Patil, Principal, KCT's Krishna College of Pharmacy, Karad. Today we are going to discuss about topic pharmacodynamics from pharmacology and toxicology. Learning objectives. After watching this video, students should be able to define pharmacodynamics, explain principles of drug action, and discuss factors which modify drug action. Nowadays, drugs are available in various dosage forms. To achieve desired action, first it need to get drug absorbed, distributed and get access in the blood plasma. And from the blood plasma, it should be reaches at the site of action. And at the site of action, they interact with the cell and produces the effect. So, by which mechanism it interact with the components of a cell, that is receptors, and what a physiological changes takes place is called as a pharmacodynamics. So in systematic manner, pharmacodynamic is defined as a branch of pharmacology which deals with the study of mechanism of action and pharmacological effects of a drug. Means in short, what the drug does to the body. Principles of drug action. Actions produced by the drugs are generally based on following principles. These are the stimulation, depression, irritation, replacement, and cytotoxic action. Let us see one by one. Stimulation means selective enhancement of the level of activity of specialized cells. That is, activity of particular group of cells get increased. Example, adrenaline is the cardiac stimulant which stimulates heart and increases heart rate and force of contraction. On the other hand, caffeine is the CNS stimulant. Depression. On the other hand, depression means inhibition, that is diminution or decrease the activity of particular group of a cell. Barbiturates, example phenobarbital, depresses CNS and used as hypnotic sedative, whereas quinidine is the cardiac depressant. Irritation. Some drugs produces action by irritation mechanism. That is, it irritates some particular tissue and produces noxious effect. For example, ammonium chloride irritates the respiratory mucosa and causes expectoration effect and expels the cough. Replacement. Some drugs are administered whenever there is a deficiency state. These drugs are either enzymes or hormones. For example, use of insulin in diabetes mellitus. Cytotoxic action is one another principle which suppress the growth of a foreign unwanted cells in body. Some drugs show the toxic towards the foreign unwanted cells in body. For example, antibiotics used in treatment of a infectious disease where they kills the pathogenic bacteria. And another example is the anti-cancer drug like vincristine kills the cancerous cells. Some drugs are indicated in one condition at the same time and they are contraindicated in certain condition. Dose of the particular drug is not same in all category people. It is different in children and different in adult. So, why this such variations takes place? That is, some drugs are indicated in one condition and contraindicated in another condition, and dose is varies according different in different category people. So time is now reflect. So reflect on this question: which factor should be considered while prescribing the drugs and its a dose? So pause the video, think on this question and write the answer in your notebook. Hope you are written the answer for above question. Now check the answer. There are much more factors which affect the action of drug as well as need to be considered while calculating the dose of a drug. These factors are as follows: body weight, age, sex, climate, genetics, route of administration, time of administration, psychological factor, disease state, combination therapy likes additive effects, synergism and antagonism. Let us see one by one. Body weight. Average adult dose is specified by considering average adult weight of a 70 kg. But this dose may be less if prescribed in obese person, that is above the 100 kg, or it may be high in case of a lean, that is malnourished patient, and also less in the children. So dose in such a patients is calculated on the basis of a body weight, and it is calculated by the formula individual dose is equal to body weight in kg divided by 70 into average adult dose. Age. There is a basic physiological variation between infant, children and adults. The newborn and in children have low GFR, less drug metabolism capacity. On the other hand, in elderly patient, kidney function is progressively declined. So generally dose of drug is calculated by considering the age. There are number of formulas are available for calculation of a child dose, like Young's formula, Dilling's and Clerk formula. Sex. Sex is one another important factor need to be taken into consideration while prescribing drug, because female has smaller body size as compared to male, and female have to need pass delicate periods like menstruation, pregnancy and lactation throughout her life. So these factors should be considered while prescribing the drug. For example, morphine is contraindicated in pregnancy as it crosses the placental barrier and affect on the fetus respiration. Genetics. Drug metabolizing enzymes are genetically controlled, and deficiency of certain enzymes may lead to toxicity on administration of particular drug. For example, a person having the deficiency of glucose 6-phosphate dehydrogenase enzyme, and in such a person, if we administer the anti-malaria drug like primaquine, it may lead to the hemolysis. Route of administration. Route of administration governs the speed and intensity of a drug response, that is onset of action as well as the amount required to produce the effect is depends upon the by which route drug is administered. For example, in case of a intravenous route, dose is also small as well as onset of action is very fast. On the other hand, drug if administered by topically or oral route, its onset of action is slow as well as dose requirement is also high. Time of administration is one another factor which is taken into consideration while prescribing the drug. Some drugs are absorbed fastly in empty stomach, whereas some drugs absorbed after the full stomach, after meal. So type of a diet and gap between meals and medicine affect the absorption of a drug. Example, hypnotics are generally prescribed at the night, and they are more effective at the night time as CNS get declined. Some drugs are generally taken in empty stomach for its a better absorption. Example, iron compounds. Psychological factor. Response of a drug can be modified by patient belief, attitude and expectation, particularly in case of a CNS acting drugs. Example, placebo therapy. Disease state. Not only drugs modifies the disease state, but several diseases can influence the drug action. Example, GIT diseases may affect absorption, whereas the liver diseases may affect the metabolism. Generally, drugs are given in combination. So combination therapy is one another factor which affect the drug action. If drugs are given in combination, generally to either increase or decrease the drug responses. If drugs are in additive effect, if drugs are given together and their total pharmacological effect is a sum of individual drug, that is 1 plus 1 is equal to 2. Then it is called as additive effect. Example, CNS depressant drug like barbiturate, phenobarbital and diazepam given together. Synergism. When two or more drugs are given together, total pharmacological effect is more than the sum of their individual drug response. That is 1 plus 1 is equal to 3. clotrimazole, that is combination of a trimethoprim and sulfamethoxazole, is used as a antibacterial, shows the synergistic effect. Whereas in case of synergism, if one drug increases the duration of action of another drug, then it is called as a time synergism. Example, procaine given along with adrenaline. Antagonism, when one drug reduces the effect of another drug, is called as the antagonism. This antagonism may be beneficial or sometimes harmful. So this factor also should be taken while prescribing the drug. Example, acid and alkali given together, it shows the neutralization effect. It is an example of a chemical antagonism. In summarized session, we can say that pharmacodynamic study includes the mechanism of action, pharmacological effect, and physiochemical changes. Drugs produce the action by principles like stimulation, depression, irritation, replacement, and cytotoxic mechanism. And while prescribing drug, various factors should be taken into consideration. Thank you. Thank you very much.